My entire life, I've always been a vintage designer bag kind of girl.
Let's go see some of my favorite buildings in the city today. No one needs another video of a white girl making matcha, but Sandra...
This is Ruby Benson, a Canadian social media creator whose audience, more than 100,000 strong across Instagram and TikTok, check in for her eye on interiors, fashion, and the small details that make a life feel well-designed. Her posts move between her carefully styled Toronto home and the city's openings and launches, where taste and aspiration subtly brush up against one another. Ruby is warm, matter-of-fact, familiar, someone you could imagine knowing or even becoming friends with, as she shares curated glimpses of her day-to-day. Until recently, though, there was a significant part of her life that never made it into frame.
I'm not the most open with my personal life on social media. You know, you come to my page, you don't necessarily know who my best friends are, who my family is, you know, what I'm doing in my off time.
Her page, her story. Like any social media influencer, Ruby gets to control the narrative, what you see and what you don't see. But a few years ago, that all changed. This is the part of Ruby's story her followers didn't know. She'd tested positive for a BRCA gene mutation, one that dramatically raises the risk of breast, ovarian, and pancreatic cancers in women and prostate and pancreatic cancers in men. Faced with that reality, she chose to undergo a preventative double mastectomy in the hopes this would help avoid a cancer diagnosis in the future.
I wanted to have control over this situation that is not necessarily a situation that I had full control over. So I thought, you know, if I can at least pick my surgery date, pick the surgeon that I want to work with on this and have control over the scenario, I think that was something that really made me feel a little bit more calm about the whole thing.
It was, in part, a way of taking back control of her body and what might be happening to it. She started by getting as much information as possible because in moments like this, knowledge can be its own kind of power.
I was really just looking for a young woman the same age as me to kind of relate to. A friend of a friend ended up also having BRCA, and she went through the whole process of the preventative mastectomy before me. And I had never spoken to or heard a story from someone who was around my age sharing their experience. And so having that friend who was able to share her experience and answer all my questions before I actually had to go through it was so life-changing for me and so special for me. And I'm so grateful for her for sharing that with me. So I thought to myself, you know, this is not maybe something I'm the most comfortable with sharing, but I think if I could give what she gave to me to at least one other person, it would be worth it. Sorry.
Wow, you're making me all emotional just hearing you.
Sorry, I'm actually not. Actually, maybe I am a crier. I don't know. But I think what gets me worked up is the gratitude towards that friend and, you know, her sharing her experience with me. It just made it so much easier and more comfortable for me.
It's that sense of being carried by someone else's experience that still moves her. A stranger's honesty becoming a kind of guide and then, in turn, offering that same honesty to someone who needs it next. Ruby stepped into that circle of young women navigating BRCA, taking in what they shared and eventually sharing her own story back. She went through the surgery, then the recovery, and gradually life found its rhythm. Then it changed again. Despite her radical efforts to avoid cancer, Ruby became part of another group of young women, dramatically rising in number, those diagnosed with thyroid cancer.
I didn't have a history of any thyroid-related illness. When I had gone to the doctors beforehand, they told me my thyroid levels based on my blood tests were better than normal. So this was all something that was obviously very shocking to me.
This is Carry the Fire, a podcast by the Princess Margaret Cancer Foundation featuring inspiring personal stories about What happens when world-leading doctors, researchers, and their patients come together to ignite breakthroughs in cancer diagnostics, research, and treatment? This is a podcast about innovation and radical hope. I'm your host, Lisa Laflamme. In this episode, we explore the sharp increase in cancer among young people through Ruby Benson's story, with insight from cancer researcher Dr. Stambolic. Cancer has been a constant in Ruby Benson's life. She was just 3 years old when she lost her mother to ovarian cancer. Then, at 13, doctors discovered that her father carried the BRCA gene mutation. At 26, Ruby learned she carried it also. And when she was 31, Ruby noticed a lump in her neck. Her doctor reassured her it was probably a cyst, but recommended a biopsy. It came back benign, and she kept up with regular monitoring just in case. For 3 years, nothing changed.
And then, joke's on me, the fourth year, the year that I didn't have to go for an ultrasound, I could visibly see it in my neck, so I knew it had grown. So I went back for another ultrasound and then another biopsy, and then that biopsy came back inconclusive but suspicious for papillary carcinoma, which is the most common form of thyroid cancer.
The results didn't give a clear answer and could not rule out cancer. The only way to be sure was another surgery. How did you find out about the thyroid cancer?
So I got a phone call about it, and I was on my way to go grocery shopping, and I still went grocery shopping afterwards. Well, I came back in briefly, and I told my partner, and we had a little bit of a sit down about it, and then I went grocery shopping afterwards.
Amazing. That you're incredibly resilient to go grocery shopping. I'm sure you ended up buying random things that day because
Probably lots of chocolate.
Oh, yes. That's very therapeutic. But were you afraid to tell your dad, your family?
Yes. When I found out that I had thyroid cancer, I was most nervous to tell my family because I didn't want them to worry about me.
Did you ever wonder why you got thyroid cancer?
Yes, definitely. That's definitely something I still, people will ask me, oh, does it run in your family? Or did you have Hashimoto's or Graves before? Any issues with your thyroid? And no, I didn't. And no one in my family has this. And thyroid cancer is not even related to BRCA. So this one was just a little special treat.
I wanted to share an aspect of my private life publicly in the...
So Ruby went back to a familiar instinct, reaching out and asking questions in the open.
I did try to research this, but there were no answers that really came up for me.
Did you know about young people getting more cancers?
The numbers were a little alarming. I never expected to receive so many messages, even just from people that I know personally. And that's when I first thought, oh, this is very prevalent.
Thyroid cancer, colorectal cancer, breast cancer. They're among a few cancers climbing in young people. In cancer terms, young people refers to anyone under 50 years old. The question is, what's driving this trend?
In the 30 years that I've been on this job, we've seen tremendous drop in cancer mortality. What we're also seeing is an increase in cancer rates and in cancer diagnosis.
To answer that question, I'm talking to Dr. Stambolic, a senior scientist at Princess Margaret Cancer Center.
This is in part driven by the fact that we have much more powerful means of finding cancer, but it doesn't explain everything. I think that there is an underlying rise in cancer incidence in cancers that would not necessarily be caught by these new methods. And I think that this is something that we have to pay a lot of attention to.
But a dramatic number of people, an increase in people, are being diagnosed with cancer.
They are, and there was a conversation recently that we've had about thyroid cancer and pretty crazy increases in thyroid cancer incidence, especially in certain places around the world. South Korea popped up off the charts on this map, and it could not be explained by anything that was environmental exposure like Fukushima or something like that.
Yeah, I was reading, I think it was in The Lancet, which was really startling. Not only have cancer rates increased 2 to 3 times higher than they were even in the 1950s, but specifically that women over men, and the cases of women with colorectal cancer and breast cancer, of course, and thyroid cancer. What do you think in your research points to the reason behind this?
I think that what's really going on is we're also seeing some of the environmental and exposure changes that are changing what are sort of human traits that are driven by hormones. And in the case of female hormones, certain hormonal related cancers are certainly on the increase. And I can mention breast cancer and uterine cancer and ovarian cancer in women. And I think some of the increases are relating to that. And
It's not just women, it's young women.
it's absolutely young women. And I think that it is worth touching upon lifestyle choices. It's worth touching upon things such as voluntary exposures as opposed to involuntary exposures. And, in terms of consumption of alcohol and various other things, my theme of research is very much around nutrition and diet and obesity, which I think is a massive, massive driver of what we're actually seeing. There's a study that was just published today on colorectal cancer incidence in a massive group, over 100,000 people followed in France. And there are additives in the foods that you and I have consumed today that we are unavoidable that are contributing to both type 2 diabetes and cancer risk. In my mind, that's absolutely unacceptable.
Yeah, and I think fructose is one that has been a major one for you. Give me your perspective on the impact of fructose on our diet.
I joke sometimes that having a glass of orange juice is like having a glass of lard.
Oh, okay. Thanks for the mental image on that. I'll never drink it again. So the research is clear about the effect of exposure-related factors like diet and exercise, but those risk factors don't actually apply to Ruby.
I live a very healthy, active lifestyle. And, ever since I found out that I had BRCA, I've been very health conscious. However, I do love my chocolate and I love a sweet treat. Sweet treats are my favorite. But, I'm very active with horseback riding. I have a very active dog too, who requires at least 1 to 2 hours of hiking or high intensity play every day. So I would say I'm generally a very healthy person.
I wonder if there's any specific intervention that can be done for young people.
Education. I don't think the young people think much about disease or, for that matter, being ill or anything being wrong with them. I really think that, that needs to change as well.
Yeah, maybe, for young people, there's that invincibility attached to age where you really have to feel rotten to go to a doctor.
Yeah, I mean, we don't want young people to be in any way, scared of going to the doctor or, for that matter. But I think that recognizing that in every context, early detection leads to better outcomes, whether that is cancer or some other disease, is huge. I mean, there's a huge untapped opportunity there in the entirety of medicine.
Catching cancer early can change everything. As Dr. Stambolic says, more young people are being diagnosed than ever before, but because of early detection, far fewer are dying. Ruby's story shows exactly why that matters.
I am so lucky in the sense that I didn't have to have radiation or chemo. My thyroid treatment was probably the best case scenario. I only had to get a hemithyroidectomy, so I got to leave half of it in, and the remaining half of my thyroid ended up producing a stable amount of my hormones, so I never had to go on any of the medication. But there are a lot of people who have hemithyroidectomies or full thyroidectomies. They need to be on medication for the rest of their life, because if you take out your whole thyroid, you have no body part that's producing hormones for you.
I know that control is, I think with anybody, but especially you, it's a key component to everyday life. You took control when you determined you had BRCA, double mastectomy. Then thyroid hits. What happens to control at that point? It's totally out of your control.
Yes, I think all of these things at the end of the day were totally out of my control. But what can I do to gain that sense of control for myself again? And that was making appointments with the doctors and the surgeons, finding out every little tidbit about thyroid cancer that I could, to feel more empowered about the decision I was going to make in terms of having the hemithyroidectomy moving forward. So I think I really regained that sense of control by doing research and, just informing myself and speaking to doctors and surgeons, and just really making myself feel confident about the decision I was going to make going forward. I had another friend who I reconnected with at a crazy time right when I had gone through the thyroid surgery, and she was behind me in line at the grocery store, and we hadn't seen each other in over a decade. And we just started talking, and we reconnected on social media, and then she saw that I had posted, I believe, about it, and then she was like, "This is so crazy, but I'm kind of about to go through the same thing. Can we meet up and chat?" And yeah, so it's nice, being able to speak with people who have gone through the same thing as you.
So where are you today in the journey relative to the thyroid cancer?
So for thyroid, I have to go every 6 months to get an ultrasound on the remaining half of my thyroid to make sure that that's stable. I did meet with an endocrinologist right when I was healed from my surgery, but all of my blood levels were, thank goodness, they were normal and fine. So I got very lucky with that. And that's pretty much it. It's not that intense with, follow-ups, which is kind of crazy, but
well, that's
yeah.
great. I mean, that is one of the things about
Yeah.
thyroid cancer. You're right. You remove it and hopefully that's it.
Yeah.
For you, I mean, I can imagine after all of this, you might want to live in a glass house and not move, but instead,
I want to do the opposite.
and I want you to tell me about your horse incident right after you've recovered from cancer. Yes, I've done my homework.
Yeah. Oh, yeah. So 2025 was a bit of a year for me. I'm a passionate equestrian. I was riding 2 times a week. It's a hobby and just something that I love so much. That connection between horses and humans is just so special. They're so empathetic. And yeah, healed from the thyroid cancer, I thought, okay, life is looking up. It's summertime. I'm going to get back into horseback riding. And I was just having a regular lesson, and I ended up having a freak accident on a lovely horse that is ridden by children. He's not a dangerous horse at all. It was just a freak accident. I think he got stung by a wasp or a horsefly, and I got launched like 10 feet in the air, landed on my back, and fractured my skull and my spine.
Ruby.
So I ended up back in the hospital.
I mean, all the trauma. Do you sort of feel like your cancer experience helped you through the recovery of the riding accident?
2025, at that point, I had to laugh because I'm like, this is just comical at this point, like the amount of stuff that's happened. And I was supposed to go to Paris for Paris Fashion Week, literally 5 days after this happened. And I remember the surgeon came in and he was like, so he came in with his clipboard. So you have fractured your T1 to T4 and fractures in your spine. I looked at him and I said, okay, but I have a flight booked to Paris next week. And he goes, no, you don't. Cancel it.
God, that was probably even more devastating than,
Honestly, no, I was just joking about that the entire time. And yeah, it was fine. I don't know. I think just with going through all these things, it's just my natural take to look at the silver lining of things. Like, okay, yeah, I fractured my spine and my skull, but I walked out of the hospital. Like, when I very easily, if it was somewhere else in my spine, could have been confined to a wheelchair, and that would have obviously changed my life completely. So, yes, I had thyroid cancer, but at the end of the day, I only had to have a hemithyroidectomy, and I didn't have to go on medication. And these are all things to me, like, yeah, they're quote unquote traumatic to go through. But at the end of the day, like I said, I'm still standing. My life is still great. I'm, surrounded by people who love me and that I love. So what more could I ask for?
Did you ever get back on the horse?
Oh yeah, I'm waiting to get clear to.
I love you.
Oh yeah.
Okay, you are my new inspiration. Where are you with control now? Because you've certainly compartmentalized so many phases of your life.
I think after the year I had last year, I'm grateful to just be here and be standing and have an optimistic viewpoint on, life moving forward. In terms of control, obviously you have to relinquish some of that. There's nothing you can do. When I first found out I had BRCA, I thought that was something I'd be able to control. I thought, if I eat a certain way, there's all these diets that have been said to prevent cancer. I'm going to adopt all these. And I was like, I'm not going to eat anything that's in a plastic container because the plastic is going to leach into the food and I'm going to get cancer. It got to the point where I was like, okay, this is not a sustainable way to live. It's fine to eat the food in the plastic. Maybe it's not the best, but just eat the food. But obviously, I think, when you get diagnosed with cancer or when you get diagnosed with having this genetic mutation, you obviously feel out of control of your life. You don't feel like you have control over what's going to happen to you health-wise. So for me, gaining some type of control back, whether that was, feeling good about the way I was eating or living my life or actively making that decision to have the prophylactic double mastectomy and reconstruction so that I never had to, go through the actual experience of having breast cancer, hopefully, and then deal with that surgery after. I preferred to be more proactive and say, you know what, it is within my control to make these decisions, to pick my surgeon, to pick the date and the time that I want to have this surgery and move on with my life after that.
I would say you are in for an excellent 2026 and well deserved.
So too. Thank you.
What is next in your life?
I'm working on a lot of very exciting projects this year. I'm launching my first homeware collaborative project, hopefully in the spring. We're still sorting out a few tidbits when it comes to timing, but I'm very excited for that. I'm hoping to get back on a horse in the spring. And yeah, just traveling and living life to its fullest, being around the people that I love, my friends and family. I'm very, very grateful for them and my partner who was so supportive through all of this. And honestly, I can't begin to thank him enough because he was my rock through everything. So
important. And I hope the Paris Fashion Show is in your future as well.
There will be Paris Fashion Week later this year, yes.
You've been listening to Carry the Fire from the Princess Margaret, a world-leading cancer research center. If you found this episode meaningful, please subscribe, rate, and leave us a review. To learn more, check the show notes and share this podcast with friends and family to help create a world free from the fear of cancer. I'm Lisa Laflamme. Thank you for listening.